6, we are going to look at those routes of administration, which is how we are giving a drug and introducing it to the body. So our learning objectives is what I just did, defining that route of administration, and then just talking about all the different ways to give drugs, and then also looking at the angles of injections. So what is a route of administration? As I already mentioned, this is just how we are conveying or giving a drug, adding it to the body. So drugs can be formulated through lots of different routes. So there are lots of different ways, as we will see, to get a drug into the body. And not all of them, though, are appropriate for surgery. So for example, oral medications are rarely given in surgery because most of the time the patient is under general anesthetic and can't swallow or wouldn't be awake enough to swallow a medication. So these are divided into a few different kind of big categories. So enteral methods, think about your enteric system. So these are things going through your GI system or involved in your GI system. So oral medications, and there are a few different ways that involve the oral cavity. So we have buccal, which is on the cheek. So if you lay something against your cheek, that's buccal. Sublingual, so under the tongue, so like nitroglycerin, that's how that's typically taken. Ingestion, which is usually what we think of with oral medications. And that just means it's completely being swallowed. Buccal and sublingual are kind of hanging out in the mouth. So a feeding tube would be another example of this, where it's going directly into the stomach or to the GI or into the intestines. And then we also have rectal, because again, we're thinking about the entire GI system, so from mouth to the anus. So enteral methods would include those rectal administrations. We have inhalation as well. So we all know inhalation just means that we are inhaling or bringing something into the lungs. So especially in surgery, before or after surgery or during surgery, that anesthetic can be given that way. So a few different forms. So again, gas. So if we have a gas that has to be inhaled, but also we have those vapors. So vaporizers would be another inhalation method. So this is where that liquid is changed to the gas with that vaporizer. So like an inhaler kind of thing. So if somebody has asthma. And then also aerosols, which are kind of similar to those vapors, but instead of it being completely a liquid that goes to a gas, this is going to have some small particles. So again, a little bit of solid suspended in the gas. And sometimes those inhalers can be either the vapor or an aerosol. So that varies depending on the medication. Installation is a bit different. So in meaning it's going into, but installation is whenever we have a liquid dripped onto the body. So we think about drops. That's installation. So this acts just on the surface or it's absorbed into the capillaries. So some examples here are like eye drops or ocular drops. Ear drops, auricle or otic drops would be included here. So they're just dropping it. It's not actually getting into the body. It's really just going on the surface, but it can get absorbed by those capillaries to move throughout the body. Now parenteral, now we're skipping the GI system. So these are going to be our injections. So quite a few different types of injections. So we have intradermal, so dermal, thinking about our skin. So these are going to be within the skin. So right under the skin, still kind of part of that dermal layer. Subcutaneous, so sub meaning below, so below that cutaneous layer, which is going to be under that cutaneous membrane. Intramuscular, so it's going into the muscle. And then intravenous, which is going into the vein. So we mentioned the subcute, the intramuscular, and the intravenous when we did our abbreviations a couple chapters ago. So we put those back up as well. Subcutaneous can also be sub-SQ or SC. We also have interarterial, not used as frequently, but this is where it's going to actually go into the artery instead of the vein. Now, if we look at those angles of injections. So that's essentially what determines. So is it being given intramuscular or intravenous? So they're given at different angles. So starting with intramuscular, so whenever it's right at a 90 degrees, so we're going straight down through the skin, down through the muscle and everything, or into the muscle, is going to be intramuscular. Now, subcutaneous, we're going through the skin down to that cutaneous tissue that lays just above the muscle. So it's going in more to 45-degree angle. IV is more to 25-degree angle, of course, going in directly into the vein. And then intradermal, we're still wanting it kind of in that skin layer that's really thick because of all those squamous cells there. So it's going to be at a 10 to 15-degree angle, so almost perpendicular to the skin. So some of the other injections, quite a few of these, those were the most common, but now a little bit of the more rare ones. Intraosseous, so if you think about osteocytes or osteoporosis, hopefully you think about bones. So intraosseous is within the bone. This is useful if IV isn't available. So sometimes putting it into the bone. So if somebody is really dehydrated or their veins are collapsed, this is an alternative. Epidural. So thinking about like having a cesarean in labor and delivery especially, but other times as well. So epi means outside, and dural is referring to the dura mater of our nervous system. So we have those 3 layers of meninges. The dura is that thicker layer. So we're going just outside of that. So not quite into the spinal cord or spinal tissue, but just on the outside. Then we have intrathecal, and that's where it's actually going into the spine. So both of these related to the spine. It's just whether we're on the outside, epidural, or we're actually into the spine, intrathecal. Intraarticular, this is going to be into the joint. Intracardiac, that one's pretty easy, so it's into the heart. Now looking at the topicals, these are going to be placed on the surface. So a difference a little bit though than installation necessarily. So again, we're dropping it, moves us to installation. Topical though, anytime we're placing it on the surface, so on the skin or a mucous membrane, so not just the skin. So it can be local, which is kind of what we think of, but because of all those capillaries, there are drugs that get into the capillaries, which gives them a free ride into the circulatory system that allows them to get to the system, so systemic drugs as well. So they're not always just going to stay in that area. It depends on how the drug is designed and whether it can get into the capillaries. So some of the forms of them include what we've already talked about. So the buccal, for example, because it's touching the cheek, it's also enteral, but also topical. So it kind of can go either way there. Inhalation, because it's going on the mucous membranes of our lungs. The installation, again, we're dropping onto a surface, so still kind of following under the topical. The sublingual, again, we're just on that membrane of the mouth. And even rectal is there too, because it's just going onto the surface of the rectum. It's not going into or penetrating past that membrane. So topical is kind of special because some of the other ones we've already talked about could be classified as topical. So anytime it's just on the surface, it's topical, but sometimes we use these other terms to be more specific. Few more routes, lots of terms with this chapter, so use those note cards or some Quizlets, something like that to help you keep them all together. So intralaryngeal, that one kind of makes sense. It's into the larynx. Intratracheal, into the trachea. Sometimes science is just nice to you. Implantation, so we're implanting or inserting something under the skin or into a body structure. So we think about, especially like with birth control, some implants into the arm, or an IUD, which is going into the uterus. So we're implanting something there. Intraocular, so going into the eye. And then a subcategory of that, so if you think about the anatomy of the eye, you have the vitreous humor, which is the eye is kind of a big cavity almost filled with some fluid, but that cavity is called the vitreous humor. So if it's going particularly into that, it's called intravitreal. So anywhere into the eye is intraocular, specifically into that vitreous humor, intravitreal. Urethral, going into the urethra. So intravesicular, again, little subcategory here. This is going into the bladder specifically. And then vaginal, of course, into the vagina. So again, use those note cards, come up with a little mapping system just to help you remember where all of these routes are going.